my commentary, but sponsoring a successful retirement plan in which your employees can retire with dignity and on time can have a significant impact on mental health. So, in addition, Professor Carrie Leanne from the University of Pennsylvania, her research shows that when employees are less stressed about money in the workplace, they perform much better, in some cases, dramatically so. So, think about that, right? There is an independent organization called Brightscope, which reviews and rates retirement plans, and they provide a health score on a scale from 0 to 100 for each plan. The score is basically a combination of a number of things. They look at fees, they look at fund performance, they look at average participant account balances, deferral percentages, and so on. Now, at ISC, we took the time to research all the Brightscope reports for all the plans of the members of the Indiana Council. And what we found is there's a significant opportunity for improvement here, which clearly would benefit your organization, your culture, and most importantly, your employees. Now, think about this. Your employees are driving to work today, right? If they're not on track for a dignified retirement or they're stressed or worried about money, think about the impact that this has on their current performance in areas like presenteeism, absenteeism, productivity, morale, and turnover. And I know last year when we were at the conference in Bloomington, these were some of the major topics that you talked about at the meeting. Now, an interesting statistic or a report from Empower Retirement, some of you may use Empower as a record keeper. They came out with a report recently that shows people think of money 4 hours a day. It's on their mind 4 hours a day. That's like a part-time job worrying about your finances. So for all these reasons, we need to do better here, and we can do better. So at ISC Group for 30 years, we've been doing this now for 30 years, we're serving over 250 hospitals, nonprofit, and mental health care organizations. And our slogan says it all, serving those in service to others, right? And that's not, well, I should say not a slogan, it's actually a mission. So ISC has been very successful because we measure outcomes. Most advisor relationships do not measure outcomes. We measure outcomes by utilizing the 90-10-90 Plan Success Benchmark developed by behavioral economist Dr. Somo Bonazzi from UCLA. He wrote this book right here, Save More Tomorrow. For those of you who don't want a copy of it, just let me know. We hold ourselves accountable to meet and exceed this benchmark with each and every plan we work on. So it's 90% or better participation. We are encouraging employees to put away 10 pennies on every dollar. You make a dollar, you put 10 pennies away your whole career. That's the number. And 90% of the money needs to be professionally managed in a target date, target risk environment, because that's what employees want and it's what they need. So in summary, we accomplish this in two ways. Number one, we place a heavy emphasis on plan design, in effect, to nudge employees to make better decisions. And Dr. Richard Thaler from the University of Chicago, won the Nobel Prize in Economics, wrote this book called Nudge, which is all about that, right? How do you nudge people to get around inertia and make better decisions? So plan design is a big piece. Two is the white glove ongoing participant service. And I will highlight ongoing. This is not a one-time thing. This has to be, you tell them, you repeat it, you educate, you show up, you build relationships with participants, and the needle slowly starts moving to the 90-10-90. It's got to be ongoing because we have to demystify the process. People are confused and stressed in many cases when it comes to making investment decisions. So because of our approach of focusing on outcomes, right? Outcomes. Many of our clients state that we're not a vendor, we are a true partner. And so you need to have an action plan with your advisor. And that action plan has to center around the 90-10-90 benchmark and the progress that you're making on that year over year. Because in the end, right, what's the most important thing? Success for your participants. So we're proud to sponsor the meeting coming up this week. And we're looking forward to it. Like I said, a lot of good things happening in Bloomington. Now, in closing, if you'd like a copy of the Brightscope report for your specific plan to see how you're doing, remember, this is an independent rating service. Stop by our booth. I'll have the laptop. We can pull up the report and show it to you. And then the last thing I'll tell you is in the background here, you can see our Skate for Mental Health. So in conjunction with NAMI, we are putting together a really cool event on December 13th at the Carmel Chris Crindle Market. You'll be getting some information on this, but we know during the holidays is a time many people struggle with mental health. So what we're gonna do is we're gonna reverse that. We're gonna invite all the members of the council to come down and spend Saturday morning, December 13th, on the outdoor rink at the Carmel Chris Crindle Market. So thank you so much, Zoe. Look forward to seeing you all in a few days. God bless you. Thank you.
Great. Awesome. Thank you. Carrie, I'm going to turn it over to you.
All right, perfect. Well, hello, everybody. As Zoe mentioned, I'm here to talk about the Indiana Pregnancy Promise Program. We've had some updates since the last time I came and talked to you, so I'm really excited to share those. Confirming you can see the slide on the screen. And I lost your
No.
faces when I
No,
pushed share.
we cannot.
Huh. Let me see. It says it's sharing. What about now? Perfect.
Yes.
All right, so we'll do. All right, so last time I talked, we had an emphasis on opioid use disorder and caring for pregnant moms with opioid use disorder. And I am excited to share that as of July this year, we were able to expand to cover all substance use disorder. So that's a little bit of what I'm going to be talking about today. With that expansion, we did update our tagline. So it is now promoting recovery and opportunity, maternal infant support and engagement. And if you have our old materials hanging in your office, I'm happy to send you new ones so you can have our updated criteria hanging in your offices. So the Pregnancy Promise Program is a free voluntary program for pregnant and postpartum Medicaid beneficiaries who have current or past substance use. They receive enhanced case management and care coordination services from a case manager that is located at their Medicaid health plan. And this case management begins in pregnancy and then extends through 12 months postpartum. We have a few different funding sources for this program. Originally, we were fully funded by the Centers for Medicare and Medicaid Services Maternal Opioid Misuse Model, and that funding goes through the end of December of this year. Additionally, we received a grant from SAMHSA for a pregnant and postpartum women pilot that began in September of 2024 and goes through September of 2027 with potentials for renewable funding. And then additionally, we are receiving some of the state opioid settlement funds. Those currently go through June of 2027, but have potential for renewal as well. So this graphic does a really good job showing what it is we're aiming to do. We're identifying pregnant individuals as early in their pregnancy as possible and then begin getting them linked to everything they need. So making sure that they're accessing the appropriate prenatal care and any other physical health care, making sure that they're accessing their behavioral or mental health care in their area of the state, making sure that they're getting into SUD treatment and recovery services, and then also making sure that they have those health related social needs met. So do they have housing? Do they have transportation? Do they have food? Really taking a look at everything they need and getting to them linked to those things in real time, making sure that they are able to carry those resources on into labor and delivery, and then also the postpartum period. Once the baby is born, we make sure that the mother is attending her postpartum follow-up care, while also making sure that the infant is getting the care they need. So making sure that they're linked to a pediatrician and they're getting their well child visits, making sure if the baby needs any therapies or anything like that, making sure that they're linked to those. So really taking a multi-generational approach to care for both the parent and the infant. So as I mentioned, our goals are to ensure that they're getting that prenatal and postpartum care. The data shows that pregnant individuals with substance use disorder, specifically opioid use disorder, tend to have less than 5 prenatal care visits in their entire pregnancy. So we're really working to get them into that regular care throughout their pregnancy and postpartum period. We work with them to achieve sustained recovery and access the treatment needed for that. We will work with people wherever they are in their recovery journey. We've had people who are still actively using and not ready to start medication yet, but wanting to start with harm reduction services. We get them linked to those services. We've had people who've been in recovery for a while, but then they find out they're pregnant and pregnancy is really stressful and they want extra support, and we're able to work with them. So we really work with people wherever they are in their recovery journey. We help them address their other physical and mental health conditions. We've had many moms who have enrolled and haven't had dental care in like 10 years, and we make sure they're getting linked up to that dental care. We've had moms who, can barely see, but they haven't been able to get glasses, getting them linked to care for that. So really taking care of the whole person and getting them linked to everything that they need. And then, as I mentioned, getting those health-related social needs identified and making those appropriate referrals in real time. The goal is to provide hope and set a strong foundation for the future. It's important to mention the Pregnancy Promise Program does not replace existing resources and services. Our case managers are located at Medicaid. They don't bill Medicaid. They work to get those releases of information signed so they can work directly with the providers who are already working with the moms, but then also get them linked to the additional things that they need. We have a great group of case managers that are located at the Medicaid health plans. They are at Anthem, CareSource, MDWise, and MHS, and they are RN and LCSW level case managers. And they really take an enhanced approach to reaching out to enrolling mothers. Um, we have continuous outreach. So from the time somebody's identified, we continuously outreach them to try to get them linked to resources until they either answer the phone and enroll, or they say, no, thank you, they're not interested, or they reach that 90-day postpartum period when they're no longer eligible. So we have found that a lot of times it takes between like 8 and 13 times to get a hold of people and get them enrolled, but then we've been able to see good outcomes from there. So the Pregnancy Promise Program is available in all 92 counties of the state, and we really only have 3 eligibility criteria. They must be pregnant or within 90 days of the end of the pregnancy. So if somebody shows up to the hospital to deliver and they didn't have any prenatal care, or maybe we've been trying to get a hold of them for a while and haven't been able to get a hold of them, we have up to 90 days after the end of the pregnancy to enroll them. We will work with people whatever the outcome of the pregnancy. If the pregnancy doesn't result in a live birth, if the parent chooses adoption for the infant, if the infant does need to be removed into DCS care, we will still work with people whatever the outcome is. They must have current or previous substance use. The only substance that is not an automatic qualifier on its own to enroll is tobacco use, but any other substance we are able to work with somebody. And then they must be eligible for or receiving Medicaid health coverage through one of those Medicaid health plans. Here's our referral information. We have our public-facing website, our email inbox, and then our local and toll-free phone numbers. Our phone numbers are linked up with Indiana 211. So if somebody is needing maybe an immediate resource for food, they call the number, they talk to a 211 representative, they're able to get that immediate need met through a resource, and then they are sent through to us. Just a snapshot of our website. So if somebody wanted to make a referral, they would click that green Enroll or Refer button. It just takes 3 minutes to fill out. You would put your name and contact information as a provider, and then the name and contact information of the individual you're referring, as well as their due date in their primary language. If you have their Medicaid information, you can enter that, but it's not required. We're able to get that on our end as well. So it's super easy to make a referral. So the program experience. So I've kind of talked through this, so I'll just go very quickly. We take a no wrong door approach to referral. So it could be an individual referring themselves, a provider member, family member, friend. Once that person is identified, the case manager begins outreaching. Once they get a hold of somebody, we do get informed consent to participate. So they do have to sign a consent form saying, I know I consent to participate. I know my information is being shared with CMS, SAMHSA, et cetera. And then also we work to get those releases of information signed for the providers that they're working with. The case manager can complete several assessments and screenings. And once those assessments and screenings are done, they develop a comprehensive care plan that includes elements of the plans of safe care. So individuals who are enrolled have a prenatal plan of safe care. And then once the baby is born, it transfers into a postpartum plan of safe care. They have frequent engagement in the prenatal and postpartum period. The case managers help link them up to many different services and supports that they need, as well as providing parent education, making sure they have information on safe sleep, lactation support, tobacco cessation, and so on. We regularly outreach and make periodic review, reassessment, and referrals in real time as they are needed. That care coordination does continue through 12 months postpartum for both the parent and the infant. And as they're getting close to that 12-month postpartum period, the case manager works with them on preparing for what the next steps are. So will you still have Medicaid coverage? If so, will you continue on with case management? If you won't have Medicaid coverage, will you have private insurance? If you don't have private insurance, do we need to go through Marketplace to get you coverage? Really making sure that that parent has everything that they need to continue on in their recovery journey once the program ends. And then at the end of the 12-month period, then they transition and exit the program onto whatever their next steps are. We really think about the benefits as being connection, coordination, and prevention. They're connected with that case manager, hopefully as early in their pregnancy as possible. And then that case manager works with them through pregnancy and the postpartum period, working to coordinate care with their doctors, providers, team members, really anybody who's working with them to meet their best possible outcomes. And then by connecting individuals with healthcare and treatment, our aim is to reduce and prevent the negative impacts of substance use to the parent and the child. It's a little bit of data. So to date, we've enrolled 1,525 individuals across the state, and we've had 91 of 92 counties in with enrollment. It is my personal life goal to get that last county. So if anybody knows somebody in that white county right down there at the bottom that I can talk to, we need to get that last county. And then we've had 1,127 infants born to date, and many of our moms are still currently pregnant. Some of our preliminary outcome data through our fourth funding year that ended in June, we've had a 99% survival rate of mothers enrolled through 12 months postpartum. 94% of our mothers have had sustained recovery, so no documented or self-reported return to use or relapse. 91% of our mothers did not require a DCS removal or infant out-of-home placement following birth. 73% of mothers enrolled in the Pregnancy Promise program during the prenatal period. 83% of infants were born at a healthy birth weight. 80% of infants did not need pharmacological intervention for neonatal abstinence symptom treatment. And then 36% of our infants did have a NICU stay, and 82% of infants were born at full term. So we're pretty happy with those outcomes we've seen so far. If you are somebody who loves data, I highly recommend going to our website. We have a really good report on our website that we completed with WISE Indiana. And if you look on the screen, the areas where we have little red stars really show where we were able to show statistical significance. Overall, the Pregnancy Promise program demonstrates strong potential to enhance access to critical maternal and behavioral health services without significantly increasing Medicaid costs. These findings support the value of continued investment in comprehensive, supportive care models for pregnant and postpartum women with opioid use disorder. So I mentioned we had a program expansion this year on July 1st. We expanded the Pregnancy Promise program to support expectant and new mothers with substance use disorders beyond opioid use. And then we were able to do that with our two new funding sources, so the SAMHSA and the state opioid settlement funds that I mentioned at the beginning. The SAMHSA funds are part of a pilot program that is used to support pregnant Hoosiers over the next 3 years, with a focus on those living in rural and under-resourced communities while continuing to serve the entire state. So we have formally partnered with Centerstone and Volunteers of America with a focus on Randolph, Wayne, Fayette, Bartholomew, Monroe, Jackson, and Scott counties for the purposes of that SAMHSA grant. And we have referral coordinators located on site for the Pregnancy Promise program at both of those locations. And we're really collecting data, seeing how this works, and really are hoping to be able to expand these kinds of partnerships in the future. That being said, we have those partnerships with those two providers, but we still work with every Medicaid provider in the state of Indiana. We still focus, we still care for the whole county, but for the whole state, but for the focus of the pilot grant, we do have that smaller focus area as well. And so I'll just leave these up on the screen for a second, just some feedback we've gotten from some of the moms we've worked with. We like to share that with people when presenting. But if anybody has any questions, I'm happy to answer them. I know I'm kind of a fast talker, so.
Any questions?
I don't have any questions. I would just like to say those quotes there from the mothers are pretty powerful. Those are some powerful things those moms are saying. especially about leaving the violent situation, getting in a new pathway. So, great work.
Thank you.
Any other discussion while we have Pregnancy Promise with us?
And I can send after the meeting, Zoe, to you and Denise, I can send our consent form as well as the updated PDFs of all of the materials. I can't remember if I already sent those to you or not, but then if you want to share those out to everybody to make sure they have them. We've had some providers who have started getting that consent form signed when they make a referral, as well as the release when they have the mom right there with them and sending them over to us. And it's incredibly helpful because then our case managers can immediately begin reaching out to you. It's not a requirement to make a referral, but we do find that when people do that, it just makes the process a little bit easier for everybody. So then if we reach out to the mom a few times and we're not having any luck, we can call you and say, hey, I am not having any luck getting a hold of Betty. When do you see her again? And kind of just working together in that way. So I will get those sent to you. That way you have them on hand.
Great, and we'll put those, everyone on our member site with the presentation like we do with all of our Cup of Joe. And so thank you so much for sharing such good information. And I agree with Art that client impact is definitely significant. So thank you for your work on that. So now, Greg, do you have your Starbucks winner that you guys selected?
I do. The winner is Michael Drake.
Okay.
FHC, a big baseball fan.
Perfect. Okay. So we will get that to Michael. Michael was out with us on Hill Day. Thank you to everyone who joined us last week on Hill Day. And we are looking forward to seeing everyone tomorrow, starting with committees and then kicking off our conference on Thursday. So raise your cups. Here's to a week. Here's to a month. And really appreciate all of you guys. Thank you so much. See you soon.
Thank
Take
you
care.
so much. Great job.
Bye.
Thank you.